We have an excellent reputation and history of pass rates for our graduates. Going back a period of roughly 10 years, essentially every student who's graduated every program has passed on first time, and that's typically the measurement that is used in medical training programs, is how many of the graduates pass their certification or registry exam on the first take. But I think what puts that in context and really gives you a more well-rounded picture of our success at Carolinas College of Health Sciences is the juxtaposition, or the combination, if you will, of the pass rate with our graduation rate. And that is the unique part. Most of our students who come through our program are successful. They start and they graduate. And then the penultimate, not only do they graduate, they do exceedingly well on their certification and registry exams.
By the time I took NCLEX, I was so familiar with the format and the types of questions that I would see that I was very comfortable. And sure, I was nervous because it was the biggest test I was ever going to take in my life. But I had a sense of peace come over me as I was driving to the testing center, and I knew I was ready.
As far as the RadTech program goes, it's a 2-year program. So the entire time you're in for the first year, you have senior level students to mingle with, talk to, things of that nature. And one of the biggest questions when I first started wasn't necessarily how hard is the schoolwork, how's the college, things of that nature. Everybody wanted to know how hard is the registry. That was the big question. And all the answers we ever got, we heard stories of 100% pass rate for X number of years, things of that nature. So you always knew the whole time that you had the confidence knowing that you were going to be able to go in there and pass.
Part of our success within the nursing program relates back to our curriculum and our faculty. And part of nursing is it's an applied science. So you don't just learn theoretical content in a classroom. You have to find a way to make that connection with the student in the clinical practice area. And at Carolinas College, we have access to the top clinical facility in the area. Carolinas Medical Center provides us an opportunity to work with that staff, with us as faculty, with our students, and show them how that theoretical knowledge that we're showing them in the classroom and in the simulation labs, how that connects back to the patient and changes the patient's outcome for the best. And I think that is a driving factor to where it makes it real for the student. Their knowledge will come to life when they go over there in that facility, and it closes the circle for them.